Hello, I am Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers, Hyderabad. Today I would like to explain about ovulation to our patients. Basically, it's a very small thing, but a lot of patients get confused about when the egg is released, how is it released, when is a good time to try for pregnancy, when should they have intercourse, when should they not. So these are a few questions that I will be addressing. Before we begin all that, we need to look at the female anatomy and try to understand how the uterus and ovaries are placed. This is the uterus. These are the tubes that are connecting the ovaries to the uterus. This is the cervix and this is the entrance of the cervix. Okay, and there are in pairs. So there are two tubes, two ovaries and one uterus. Can you see how it is placed? Now when the egg is getting ready in the ovary, we'll understand the hormonal actions a little later, but we'll just try to look at the anatomy right now. So when the egg is developing in the ovary, it is released from here and gets picked up by the fallopian tubes and waits in the tube. So you can see that whichever side ovulates, if it is on the right or the left, the egg is ovulating, picked up by the tube and waits in the tube, in the center of the tube. Now if the couple were to have intercourse and it's the right time, that is if the egg has ovulated, all the sperms are deposited here in the cervix. So this is another very big question that nothing is going up, we can still feel everything coming out, the semen is not going in, but it is designed that way. The semen is supposed to be deposited in the cervix area and the sperms are supposed to swim up. The sperms swim up. Only the motile, good morphology sperms swim out of the semen which is left behind and they swim towards the egg in the tube. So this is basically the physiology and this is basically how it happens. Now you have to understand that if the volume is less, then the sperms, not enough number is deposited here. If the cervical area is having infection or it does not have an opening, then there is a problem in sperm swimming up. If it is not the right time, that the egg is not waiting in the tube, then it is a problem for fertilization itself. And that is the most common problem which we encounter in infertile patients, especially when we talk about polycystic ovarian syndrome patients. What happens is that because their periods are so far apart from each other and they don't know when they are ovulating, they can't track it from the date of periods, they don't know when the egg is waiting in the tube and they don't know when to try. This is a very big problem with PCOS. So you have to kind of understand the anatomy basically to understand what's happening. Now in all this, remember, any deformity in the ovaries or the tubes or the uterus will lead to infertility. So you have to understand that if there is a severe case of endometriosis and the ovaries are not placed here, or there is an endometrioma. Endometrioma is nothing but an endometriosis cyst. It's like a chocolate cyst. It's a fluid filled cyst inside the ovary which does not let eggs grow or ovulate. So if there is a problem in this ovary, then there is an infertility problem. If there is a problem in the tubes, if there is an infection, if there is scarring, if there is some kind of a blockage inside from previous surgeries or infections like tuberculosis, etc., or endometriosis severe stage, then the egg, even if it is picked up, it cannot be fertilized by the sperms because it is blocked. Now, if there is a problem in the uterus, there are multiple problems which we shall discuss in later videos about the problems in uterus. If there is a problem in uterus, like if there are fibroids could be anywhere. Fibroids could be anywhere. If there are fibroids inside the uterus, if there is adenomyosis, if there is severe stage endometriosis, also the uterine environment is affected and fertilization and implantation cannot happen of the embryo which is formed. So these are the problems which can be encountered and you need to understand the anatomy to be able to understand what happens next. If you want to understand more, if you want to understand when you are ovulating and if your polycystic ovaries, if your periods are far apart and you are not able to understand when you are ovulating, please contact us. You can see the numbers on the screen. We will give you more information and try to counsel you. Thank you.